Good morning, good afternoon, and good evening to all the doctors. And now I request to make a silent prayer for Dr. Subaida Kairali, who is in hands of God, mother of Dr. Ajini, webinar moderator and advisory board member, IFPH. Thank you, doctors. And now I welcome you all to the 1764th day of uninterrupted daily webinar session of IFPH. And our today's guest is Dr. Ravi Singh. He runs a successful homeopathic practice in Lucknow. He is providing bedside clinical training to homeopathic students. He is doing many awareness campaigns and also he is involved in clinical research, exploring new methods of treatment. He is conducting lectures and seminars in various homeopathic colleges and institutions. He has contributed to various national and international homeopathic channels, publishing articles and research papers on his finding and experience. Overall, he is a dedicated and pioneer in the field of homeopathy. And now I'm very happy to invite Dr. Ravi Singh. And now he is here to present on the topic of my clinical experience with Verruca Plana or flat warts, evidence-based case studies. I welcome you, doctor. And now the mic is yours. You can take up to 45 to 50 minutes for your presentation. And please allot last 10 minutes for discussion.
Okay, Namaskar and thank you, Dr. Sweta, Dr. Sani, Dr. Dhanesh, and this international forum for promoting homeopathy to provide me an opportunity to address this August gathering and to share my experience. So today my topic would be the
Dr. Ravi, can you share your it's
I'm
okay.
sharing my screen, and this is my today's topic. And my today's topic is my clinical experience with the Verruca Plana or plain water flat wart evidence-based case studies. In now today's session, I am not going to discuss much about how I have selected a particular medicine because for that purpose there are many learned doctors. My guru, Dr. M.K. Sani sir, is there who can teach you well about the how to select a medicine. But definitely I am going to share the repertorization chart, few of the things about that particular ward case which I have studied and why I find it that particular medicine in the few cases, and few cases I will show without these charts and all these things. So first of all, let me introduce you what is exactly the flat wart or Verruca plana. Flat wart or Verruca plana is a condition of the wart where you can define the smooth, small, raised papules, skin colored to brown colored, often on the skin at the face, over the neck, sometimes over the hand, sometimes over the abdomen, sometimes over the neck. And you can see this particular patient who got cured for this ugly warts. You can see how this raised papules over the scalp, over the forehead. You can see. So what is the etiology? Etiology means most of the patients are often asking us what is the cause of these warts. The cause is a virus in according to the allopathic terminology that is called as a virus, that is human papilloma virus. There are more than 100 strains of these virus, and there are certain types, that type 3, type 10, type 28 and 49, which causes these warts, and it is spread either by the direct contact or the trauma. This is allopathic terminology, but what I have seen in my clinical practice, that the grief, especially stress, is the most important factor which I have seen in my practice for the warts. Even I have seen the children who got stressed and got these warts, because if it is just a wart spreading by the virus or by the contact, everybody in the family must get these warts. But it's not so. Even I have seen the husband and wife both are not suffering with the same disease. Instead of the wife is carrying or husband is carrying this disease for the many years. So the common epidemiology is that we are seeing all the children and young adults. Only in few cases I have seen the warts in the elderly people, and many may appear in the cluster or in the lines, that is called as Kubnur phenomena. Kubnur phenomena is that thing is appearing in the line. So this is the small introduction, and now we can go with the what is the pathophysiology of the warts. what happens, the HPV virus, which causes the basal keratinocyte, infect the basal keratinocyte. Keratinocytes are the skin cells and mucosa via the microabrasion. Sometimes if there is a scratch from there, that virus enters and there that multiplies. The viral entry HPV enters basal layer where the small breaks in the skin, and the viral there they replicate. The HPV replicate in keratinocyte, promoting abnormal growth. HPV down regulate antigen presentation, dealing immune response. It is all related to the immunity, and hyperproliferation of that particular skin segment lead to acanthosis, that is the black declaration, and hyperkeratosis and papillomatosis, which you can see in this particular case, where you can see this particular boy was suffering with the how this exact eruptions you can see, these are the occurring at this boy, and how he got cured in the same manner. If you can see from the last photo, the first photo, and you can see how this growth are occurring, and in the reverse order of the appearance of symptoms, you can see how these flat parts are getting cured. The last one, the clinical diagnosis. The clinical presentation is most of the time the patients are presenting the flat, round papules, sometimes 1 to 5 millimeters, grouped on the linear due to the scratching. Sometimes because someone scratches from like this, so it is spreading. Because that causes minute abrasion, and especially why I am saying this abrasion and these things are causing aggravation, because most of the patients which are coming to us nowadays due to the aesthetic clinics, there are homeopaths who are opening the aesthetic clinics, there are different Ayurvedic physicians, even dentists are using these aesthetic clinics, and they try to remove these warts with the help of laser or some chemical application as isotretinoin and all these things. And whenever there is abrasion, either with a laser, either with the surgery, either with anything, that causes more and more occurrence of this disease, because the virus goes deep inside that particular skin, and then they proliferate, and that keratinocyte and papillomatous eruptions are forming. Diagnosis is most of the time that this Verruca Plana is always a clinical condition which you can see, and this Verruca Plana is always a clinical condition, and it can be diagnosed very easily at the clinic by just appearance. And sometimes the differential, it can also be done with the dermatoscopy, which is not available with the most of the homeopathic clinic. And biopsy is rarely needed, because sometimes when the patients are getting pressured, then they go for the skin biopsy, and the patients are coming with already with the diagnosis of skin that is called as Verruca Plana. The differential diagnosis is many other mimicking things. Sometimes the acne form eruptions like acne, sometimes the lichen planus. Although lichen planus has the three characteristic P, which one any of the educated homeopathic doctor can easily differentiate, that purple eruptions. The molluscum is also called as viral wart or water wart, or somewhat very different, in which there is a characteristic that is called as puckered scar. There is umbilication of the scar, and in these warts you cannot see the umbilication. And this is seborrheic keratosis. When there is, if you are seeing especially seborrheic keratosis in the Western countries, especially in the black Americans, you can see the seborrheic keratosis. There are formation of the layer by layer of the different spots, and that is very characteristic. I remember a Hollywood actor who has this seborrheic keratosis, and this you can see another case of this Verruca Plana which got cured with the sulfur. I'm going to explain the different cases now. Now you can see this is my first case, and this is a very recent case, and this is a case of flat part from the Unnao. And you can see this is the flat part, and this girl was suffering for more than 6 years with this ugly part. You can listen. This also बना हुआ है डॉक्टर ये इसको कम नहीं मिलेगा हाँ इधर इस साइड निकाल ये निकाल बस कितने साल से चार साल की होगी 4 साल की 5 साल की तब से इसको कंधे से स्टार्टिंग हुआ है इतना सुस्त क्यों है ये सोती हुई चली आ रही है सोती हुई चली आ रही है अच्छा चटपट है ना बहुत एक्टिव है किस क्लास में पढ़ती है ये 6th में So actually, the conversation language is always in Hindi in this English session with the patient, because I am residing in the Hindi speaking region in the Uttar Pradesh, and most of the 99% patients are speaking Hindi only. So I'm sorry for that, but I cannot transcript that. And this patient was saying that this particular words are for the last 6 years.
Doctor,
Yeah,
sorry for interrupting.
yeah.
Actually, your slide is not changing, sir.
My slide is not changing. Okay, resume. Stop share. Now I'm sharing. This was, now you can see?
Yeah, now it is okay, sir. Now it is
These are the spots for the last 6 years.
4 साल की होगी, 4 साल की, 5 साल की, तब से इसको कंधे से
Now, this is the analysis of the this particular case. A timid girl which who was fearing with the ghost, she has feeling of 4 seconds. In the last session, Dr. Saptrishi was telling that sometimes the patient has a sibling rivalry upon coming a new child in the family, and she has just not exactly the sibling rivalry, but she thought that her brother is loved more than her, and she has a feeling of 4 seconds. So we must take care. What is the, if there is a 4 second feeling of the jealousy, one must be very careful. Stammering in the speech, but still stillborn child, and hence according to symptom, I have selected the rubric haughty, and these are the rubrics which I have taken: skin warts, mouth speech stammering, mind haughty, cold tendency, buttermilk desire matha, and hand palm, perspiration hand palm, fear ghost, and 4 second feeling. And I have selected sepia for this particular case and transmitted the medicine from my clinic with her hair. I'm going to tell you about this particular method which I am using in 100% cases at my clinic. That method is called as medicine energy transfer in the later session. But now we are only focusing on the how the results are with my this Verruca Plana. So this is the case, and this case got 100%
हमने जिस दिन यहाँ से बाल लगाया था उसके कितने दिन के बाद से आपका मस्सा झड़ना चालू हो गया ये वाइट
After 1 month, all these words vanished like a miracle, and this girl was suffering for last 6 years. So this is the very recent photograph you can see, and this is the on the 28th of June, just 2 days back. The mother appeared at Zoom call, and I usually don't call my patient frequently at my clinic because I am treating with the for distance with the hair. So this is the recent photograph of this. Now listen the experience.
कैसी है ख्याति श्री?
ख्याति श्री तो ठीक है डॉक्टर, और जो स्पॉट थे तो वो भी काफी बिल्कुल मतलब ना के बराबर चले ही गए हैं लगभग।
अब कहाँ है? अब हो गया है, अब लगभग
जी
अब 100%।
थोड़ा सा हल्का जी, हल्का सा, जहाँ पे बहुत ज्यादा थे वहां पे हल्का सा था स्पॉट, लेकिन अब बेटा देखा।
So there is no spot even remaining in our treatment, and for this 6 years long trouble.
लास्ट डे था,
And I have stopped the treatment as well from my clinic.
हाँ, तो अब इनका ट्रीटमेंट चलाएं कि बंद कर दें?
डॉक्टर आप जैसा था हमारे ख्याल से तो आप ठीक हो गया, तो इसको डिसकंटिन्यू कर दूं।
अब वार्ड में तो कोई प्रॉब्लम नहीं, बाकी चीजों का।
So I have stopped the treatment from my end. Now I'm going to tell you a very interesting case, and this is a case from the country Bolivia. This patient was suffering with flight wart for last 8 years, and he has tried everything, including he has visited many dermatologists. You can see on the right side of the screen how this flat warts was occurring over the face, and every dermatologist obviously suggested initially for the chemical cauterization and later with the electrocautery, and nothing helped him. Even the laser treatment didn't help him. Now listen him.
I can listen. Just tell me. So I have seen the pictures of you have sent me, and it is Verruca Plana or plain wart. And for how many years you are suffering with this problem?
Since 2016. It's 8 years almost.
8 years. And which sort of the treatment you have taken till date?
Treatments with dermatologists, like they want to burn my skin, nitrogen, salicylic acid, something like that. Then I left because conventional medicine didn't help me at all. So I tried with alternative medicine, homeopathic. The last one were with Tuja and Dulcamara. But 2 weeks was recommended, the doses and the dosage, and the other was 1 month, but like 1 day and a half. So it didn't work, and they made me repeat for 2 weeks
Fortunately
again.
or
Didn't work
unfortunately,
at
most
all.
of the patients
So
which
I
are
thought
coming to me
probably
Who
already
prescribed
took
this
this
Dalkamara?
puja, dalkamara, and all these things.
I didn't
And-
get it, doctor.
Who prescribed you this Dalkamara and Puja?
I was a local doctor,
Local
homeopathic doctor,
Okay.
naturopatha, he said.
Okay.
So this was the case, and most of the patients, as I have already said, that most of the patients are coming to us for any other ward, not only the flat ward, are already taking homeopathic medicine puja. Nowadays, there are many YouTubers which are suggesting every ABC medicine for any of the disease, from skin eruption to the cancer, for any disease, and most of the patients are coming with already taking those medicine and making the case complicated. So forget about that. Now see the analysis of this particular case, and we have selected Netramure. This is skin warts, anger suppressed, mind untidy, postponing everything to the next day, ambition increased, mental exertion, aggravate, and discontented. These were the rubric. And I have selected Netramure and transmitted Netramure from my Lucknow clinic to the Bolivia. I think more than 4,000 miles from here. And now see the results.
Hello. Ready?
Hello, doctor.
Yeah. How are you?
Completely fine, doctor.
Pretty
My
fine.
treatment has been so well.
So, your all warts are gone, no? No?
Doctor?
Your all Verruca Plana or wart trouble is completely got cured.
Yeah, just like some dark spots, but I think will disappear over
Yeah.
time.
So, is it not difficult to digest this particular way of treatment that the patient is sitting miles, thousands of miles from here, and they are getting the effect?
Yeah.
So today I have received the hair of your sister.
And
Yeah.
now he
I
has
will-
started the treatment of his sister as well, and his father as well, for the varicose vein and for some psychiatric trouble of his sister, and now they are also getting wonderful result. So this was a case from Bolivia. Now I'm going to show you another case of flat wart from the Delhi. Now this patient is residing in Delhi, and at that time he was from the Hisar, and he was suffering with these flat wart for last 8 years, 8 long years, 8 non. Now listen the conversation, and that also contains the rubric.
After this cauterization, almost 6 months back, it increasing rapidly. Not a one. It increases by almost 50 times. It increases on the whole of my face. Okay. Then I came here in Delhi. Okay. Then I met a doctor. Okay. When I search you on YouTube.
So this was the case of this Verruca Plana. You can see, and I have taken these rubrics. Rubrics are at your screen, and you can see affectation, artificial behavior. The rubric: element of offended being, egotism, fear high places, liar, dandruff, eruption suppressed, wart, and bathing upgrade. Patient was working in a diagnostic lab and is a very curious and meticulous patient, as he was in the marketing job, telling a lie and try to convince the client with manipulation was a part and parcel of his job. That's also evident in his personal case history. One can watch the video why I have taken the rubric affectation, how he was explaining his condition. while he was in the final answer, I have selected step sagria and transmitted with the hair. Although in few cases, it's not like that every time I have selected a particular medicine and the patient got cured. Sometimes I had needed to reanalyze the case, and sometimes I have to transmit another medicine. So this was the case of the step sagria, and now most of the patient which I have seen in most of the patients, that the warts, especially the flat warts, most of the time got swelled up if the right medicine is there, and then they vanishes. Sometimes also they are dried up, but most of the time I have seen in my patient that they got swelled up. Like you are seeing in this particular case, how these warts got swelled up and now they are got cleared. You can see the dates on the photographs, how exactly these warts got cured. And after, most of the patients are also asking us if they are getting cured with the homeopathy, whether this treatment will last long or whether they will get the recurrence like other doctors. But it's not so. This patient came to my clinic after many years to show his brother, and now see the condition. This is the condition of the patient.
हमसे पूछा करते हैं ना कि बीमारी लौट के तो नहीं आएगी, क्योंकि कॉन्ट्राक्शन जब भी
29th of May last month, he came to my clinic, and you can see the wonderful changes with the step sagria. Okay.
अच्छा, आपके हाथ पैर पे दिखे क्या?
नहीं,
खाली फेस
फेस से फेस था। एक्चुअली कॉन्ट्राडिक्शन के बाद ही एग्रीमेंट हुए थे ना।
ऑपरेशन के बाद
बड़े देखेंगे तो
हाँ
मैंने हाँ दिखाया था, सफदरजंग में दिखाया था।
सफदरजंग में आपका किसी होम्योपैथिक डॉक्टर से ट्रीटमेंट दिख रहा था।
हाँ, वो
he also
underwent
suffered. Yeah, I was telling you that the Thuja is the medicine which most of the homeopaths
99% थूजा खाते हैं। थूजा कास्ट का मेडिसिन है, ठीक है। एक्चुअली ये मेडिसिन है कि जो बार्ड के लिए फेमस है।
जो आपके मिक्स मेथ वाले होम्योपैथिक डॉक्टर्स होते हैं, मैक्सिमम उनका रहता है ये पेट। इतना तो सर आजकल।
So Thuja is the most abused medicine in the homeopathy for the warts. Now next case, and this is a case from the Urgir, Maharashtra, and you can see the child. A case of wart from Udgir, Maharashtra. First consultation on the 7th March 2024. This child suffered with the flat for the last 4 years with the additional complaint of nocturnal enuresis. Most of the patients which I am seeing with the flat warts are also because of these ugly warts, they are getting depressed. And sometimes I am seeing in the cases of nocturnal enuresis, always remember either the patient is fearful, there is some fright, or it has been dominated by the parents. So he has already taken oral medicine from a local homeopathic doctor from the Latur, but nothing worked him. They are not convinced that a person can be treated from a distance with the strength of hair, hence didn't opt the treatment. This is not the first consultation.
नमस्ते सर।
नमस्ते नमस्ते
नमस्ते। हाँ।
अभी ये मेरा बेटा है 6 ईयर का, कंप्लीट है अभी, ऐसा ऐसा ऐसा।
But this time they have taken
plain wart का थोड़ा
I have
पास करिए।
explained everything about the treatment procedure, how they need to send the hair from distance, but they didn't believe. They tried something else for the 2-3 months and then get back again. Back to
स्टार्टिंग में पहले इधर ही आया था, स्टार्टिंग फर्स्ट।
you can see the child. Now on the 10th of the June, they opted the treatment. They father again consulted and requested me to start treatment.
हाँ बोलिए। जी बोलिए।
नमस्ते सर।
नमस्ते नमस्ते। आपने अपने बच्चे के लिए कंसल्ट किया था 17 मार्च को?
हाँ किया था सर, मैंने किया था।
हाँ, आपके बच्चे को चेहरे पे पूरे वार्ट्स हैं, एन्यूरिसिस नॉक्टर्नल है।
अभी ये सब वार्ट्स है।
इस पे आपने कुछ किया? जब से हमारी बात हुई थी उसके बाद इस पे उसके बाद से कुछ लगाया गया है इस पे आपने?
नहीं, अभी कुछ भी नहीं लगाया सर। अभी मैं आपका ट्रीटमेंट चालू करने के लिए आपको फोन लगाया मैं आपका।
So finally they opted the treatment, and these are the symptoms: bedwetting. Also, this particular child has a worm infestation. Bruxism or teeth grinding was also present, and which is also seen in most of the patients with recessive nocturnal or worm complaints. And these are the symptoms: ailment from the fear, face warts, teeth grinding, weather change of amusement, desire, itching around the anus. And I have selected sulfur and transmitted the medicine.
बोलिए
On the 3rd December.
कैसे हैं ये?
अनवित अभी ऐसा है अवनीश।
हाँ हाँ ठीक, कैसा है अभी इसका वार्ड? तो सब ठीक हो गया ना?
अभी वाट्स ठीक हो गया, खाली डॉट्स डॉट्स थोड़ा सा बाकी है।
डॉट्स बाकी, डॉट्स भी चला जाएगा, थोड़ा सा समय लगेगा और
समय लगा।
The parent was worried about this
और
spots, and this is the recent picture, 27th.
बोलिए कैसा है आपके अक्षर? कैसे हैं ये? बिल्कुल सब ठीक है आपके वार्ड?
हाँ सब ठीक हो गए।
Not only
बिस्तर तो नहीं गीला करते हैं ये?
सब हाँ
बिस्तर तो नहीं गीला करते हैं ना?
हाँ वो थोड़ा कम है, अभी है।
now this condition was also got cured, that particular nocturnal allergy.
बोलिए कैसा?
Now this is another case of lycopodium. I have treated this case from the West Bengal, and this patient has sold his ring to get rid of this particular trouble, which he later revealed to me to get the treatment from here. Because of this condition, this patient, all these cases are also present at my website. One can go in the detail. I cannot sum up all these things in a single session because I am trying to present the variety of the Verruca Plana cases which I have treated with the successfully with the help of classical homeopathy, only using the single medicine. I never use two medicine at a time. Always use single medicine, not only in the seminar speaking. I am using in the clinic as well. So this was a case which got cured with the lycopodium 0/1. Now a wonderful another case. This is a case of Verruca Plana ward for the 12 long years. Can you imagine how this girl was living and how this girl was facing schooling and these ugly wards for the last 12 years? Now listen.
ठीक है, यह बीमारी किसी को कभी ना ठीक हुई, और बीमारी बहुत लोगों में ठीक हुई हो। तो आपके जैसा बीमारी का केस मैंने आपको यही दिखाया है। अभी आप सोचते आप मर जाओगे, हाँ? आप मर जाओगे, हो जाएगा वो
Losing of life. She had the desire to die because of this problem.
कोई बड़ा चीज नहीं बेटा, आप अपना ही चेहरा देख के खुश हो जाओगे, एक टाइम आएगा।
I was confident enough that I will be able to cure this particular little girl. And sometimes during the practice, you yourself thought that how I will be able to cure this particular patient, that the patient who are suffering with this so much in such a condition that their patient are fearing to end their life due to these ugly warts. So she was in the situation that she should end her life for this long 12 years. And now see this reproduction chart: obstinate, 4-second feeling, art ability, egotism, sensitive criticism, element from neglected being by the mother, death desire, despair, recovery, and warts. The carcinosin was the medicine. And as I have already narrated you that the most of the patient which are getting warts, the warts often, if their medicine is right, they got swelled up. And this was the right condition. And when she reported me over the phone that the warts are getting swelled up, I was so happy that within the few days she must be getting cured. And now you see these warts are getting swelled up. Now
सर ठीक है, थोड़ा सा फेस अभी भी कोई बहुत खास फर्क नहीं लग रहा सर।
आपने जो हमको फोटो भेजा था उसमें क्या हुआ था, उसमें आपके वार्ड अपनी जगह पे उभर गए थे, ठीक है, और वार्ड में कोई भी नए वार्ड नहीं आए हैं। हमने आपको कंपैरेटिव फोटो भेजा है, देखा आपने? आपको फोटो वार्ड से
नए वार्ड्स तो नहीं आए हैं, ये
नए वार्ड नहीं आए हैं, और ये जो आपके वार्ड अपनी जगह पे स्वेल कर गए हैं ना, अब ये ठीक हो जाएंगे। अब देखिएगा 15-20 दिन के अंदर सब गायब हो जाएगा, ठीक, 15-20 दिन के अंदर सब पक्का।
So I was confident enough after seeing these
परेशान
words
हाँ,
that
positive
they
नहीं।
will be getting cured. It's 12 years long
हाँ
back.
तो भरना वो, हाँ तो आपने क्या किया उस पे?
कुछ नहीं सर, कुछ किया ही नहीं, ऐसे देख रहे हैं, हो रहा है।
देख लें और देखिएगा, आपका बिल्कुल क्लियर फेस हो जाएगा, सुंदर सी प्यारी सी बच्ची हो जाओगी। ठीक?
Yes.
Now, this is the condition, how she got cured. Now
ठीक
listen,
है।
listen her.
कैसी हैं आप?
सर बहुत ठीक हो गया, एकदम सब एकदम नॉर्मल हो गया, बहुत ही ज्यादा ठीक हो गया पहले से।
अभी आप कहाँ बचा है? तो वाट तो सब चले गए खाली आप।
ये सर बस अब दाग वैसे थोड़ा थोड़ा दिखता है, बाकी तो एकदम सही हो गया।
So this is a video of 2023. Now she has a clear face. I don't have to photograph.
ठीक है, बहुत अच्छा। आपको लगता था आप ठीक हो जाओगे?
नो सर।
कितने साल से थे आपको ये वाट्स?
सर ये 8-9 साल, 3rd क्लास में थे तब से हुआ है समझ लीजिए, और आज हम 11th क्लास में आ गए हैं।
और आप निराश थे कि अभी ठीक नहीं होगा, जिंदगी भर ऐसे रहेगा।
हाँ
So
सर,
homeopathy is
इतनी दवाई कराए मतलब।
इतनी दवाई कराए, और हम तो दवाई खाने का देते ही नहीं, बिन खिलाए ठीक कर दिया आपको, बिना लगाए ठीक कर दिया आपको।
विश्वास ही नहीं हो रहा था कि ना दवाई खानी है ना लगानी है, पता नहीं कैसे ठीक होगा भी कि नहीं होगा, एकदम कुछ नहीं।
So my testimony is my
ये
result.
चीजें बस राइट मेडिसिन होनी चाहिए।
The right
आपका जब हमने शुरुआत में मेडिसिन किया तो 2-3।
So why I am showing all these cases of long words? Because once I have heard our past CCRS president, Dr. R.K. Manchanda sir, at our Patna seminar, he said that all warts are getting cured within 1 year with treatment or without treatment. And what you are seeing, that the patients are coming for us for 8 years, 10 years, 15 years, long wart, and they are getting cured. It's not like that all the warts are going to get spontaneously cured. The patients are coming to us with a so long wart. This is a case, another case of a patient who was a medical student or preparing for the medical student at the Kota factory. You must have heard that the Kota is a place where the persons are going to get preparation for the NEET examination, and this was the condition. Now see,
कितने साल हो गए इसको निकले हुए आपको? 3 years। बढ़ भी रहा है कि अपने पर रुका है? थोड़े थोड़े बढ़ भी रहा है।
no, this was the condition, and these are the rubrics: skin warts, elements on the domination, timidity, fastidiousness, dullness. He has a constant pressure, as most of the patient in the. You might have watched the movie that Kota factory. Patient was doing his NEET preparation, was trying to fulfill his parents' expectation, who told him that by any hook or crook he must qualify. His speed was slow, but he was working hard, and finally he cracked the NEET examination and he's entered in the KGMC Lucknow. Now see the result with that particular medicine, lack of podium, which didn't work. Carcinosin also failed, but finally Natromure was selected, and that.
कैसे हो आप?
बढ़िया होगा।
कंडीशन तो आपकी बहुत अच्छी हो गई।
He got finally cured with the
क्यों ट्रीटमेंट ब्रेक कर रहे हैं बीच में?
classical homeopathy. Now see the comparative pictures. This is the video of the patient which he shared with me. And he got completely and 100% cured with the help of classical homeopathy. You can see the comparative picture as well, how these warts are getting vanished, and not even the single scar left. This is the comparative picture also. And the most rewarding part, he's now joined his MBBS in the KGMC Lucknow, and he said, sir, मार्क रह गए हैं सर दिवाली पर लखनऊ आना हुआ तो क्लिनिक पर मिलने आऊंगा. He will meet me at the Diwali. And as a MBBS फर्स्ट ईयर स्टूडेंट, मैंने अपने प्रोफेसर को बताया आपके ट्रीटमेंट के बारे में, तो वो सर बिलीव नहीं कर पा रहे हैं. मैंने उनको प्रीवियस फोटो दिखाई तो वो बोल रहे हैं, हाउ इट इज पॉसिबल टू गेट rid of these ugly warts without eating or applying anything. So I have sent him the cases of my different diseases condition which got cured, like CSF rhinorrhea, chyluria, Hasbrook disease, and all these things. So this is the testimony of the patient who is doing MBBS. Now this is another case of flat wart. You can see the comparative pictures, and this case was also got cured with a sulfur transfusion. You can see the comparative picture of this condition. Now another patient, you can see this condition. I'm taking to share. Yes. This is the another patient. You can see. And this was a patient of sulfur as well in the long run. Another patient, and this is a patient from the Sikkim, and she also got treated, and she was getting treated with the help of lycopodium 0/1 transfusion. Another case, and this was a case from the Datia, Madhya Pradesh, and amazingly, this patient received the result within 1 week of start of the treatment, and she got cured. I think the medicine was CPI at that time. I don't remember exactly. This is another case of the lycopodium. You can see lycopodium transfusion, how this wonderfully got cured. Another case from the Lucknow only, and this girl this was baffled me for almost 6 months. I've tried many medicines, including casticum, CPI, and all these things, and finally, a nosode, according to the symptom that carcinosin helped him, and she got cured. Another case at my clinic, this is a case of lycopodium, and these warts were for the last 3 years, and he also got cured with lycopodium. Another case of the lycopodium. You can see the complete pictures, the first picture, second picture, and third picture, and within the 2 or 3 months, his all warts got cured. You can see the first picture is January 31st, April 10th, and May 23. This is you can see at the bottom of this, these are the dates where you can see. This was my first case of flat wart, and it was a case from the Balrampur where I was practicing and where I am hailing from, the Balrampur, and this was a case which baffled me for the 2-3 months, and finally I have transferred the medicine with help of my guru, Dr. M.K. Sani sir, who suggested me to opt sulfur for this particular sorry case. And now see the stages, how these warts get swelled up, and finally these warts got clear. Now you can see the 6/3/2010, 6/3/2010, 26/6/2010. This is a very old case, and he got cured with the help of this. Now, another case. Many other patients which are coming to me at my clinic, and sometimes the patients are getting treated online through my online treatment procedure. They are sending their hair in an envelope. And this is a similar case, and you can see this is a case from the Karnal, Haryana, and this lady was suffering for this flat wart for the last 3 years. Now see the condition. Sorry, this is the picture. Sorry. Now watch the condition. How this ugly warts was there. They are spreading over the body part as well. And they were covering the whole face of this particular lady. Now, this is the repercussion chart, and I have selected On the basis of her mental symptom, dictatorial was the main theme. Dalkamara was transmitted, and see the difference. How wonderfully this particular medicine cured her for this years-long Verruca Plana of flight ward. Now her sister is under my treatment for another trouble. So this case got treated online. She has sent her hair from Karnal, and I have received and transmitted the medicine Dalkamara from my center. I have shown you the same disease condition with the different medicines, sometimes CPS, sometimes lycopodium, sulfur, carcinosin. So this case got cured 100% with the help of Dalkamara. Now another case, a single remedy case cured by the carcinosin. This case also baffled me for more than 6 to 8 months. Finally, I have arrived at particular medicine carcinosin, and he got cured. Now another case, this patient has requested me to put my video on the YouTube because this initially in the first 6 months he didn't receive any response and he was so afraid. But again, he left the treatment, and again after 1 month he again said to me, "Now doctor, you tell me, you have to cure me." So I have again studied the case and then selected a medicine CPA, and finally he got cured. Now watch the first video at my clinic.
ये सर चौथा साल चल रहा है.
For the 4 long years, this patient was suffering with these ugly words.
अभी लिया है सर, महीना भर हुआ है सर.
और होम्योपैथी
होम्योपैथी लिया है, एलोपैथिक तो मैंने केमिकल लगवाया था 4 बार.
4 times he got chemical cauterization.
से गायब हो जाता, उस जगह आ जाता है कि और नई जगह आ जाता है?
नहीं, उस जगह पे आता है सर.
इस बीमारी की वजह से, इस बाढ़ की वजह से आपके लाइफ में क्या प्रॉब्लम है?
बहुत सारी प्रॉब्लम है सर. जहाँ भी शादी प्रोग्राम में जाता हूँ तो बहुत दिक्कत आती है. पूछते हैं कि
God never kill you, but it
अभी
can
शादी
affect
नहीं
your
हुई,
social
कोई
life.
प्रॉब्लम आ रही है.
In the last patient you have seen that patient has a thought of
ये भी हो सकता
ending
है.
her life.
ठीक भी होंगे, शादी भी होगी, उनको मिठाई भी खिलाइएगा.
ठीक खिलाएंगे पक्का.
I was confident enough that I will be able to cure this particular.
हाँ.
Why?
तो
ना
हाँ.
खाने की दवा नहीं मिलेगा कोई यहाँ पे. सभी रोगियों को बाल के इलाज करते हैं. केस हिस्ट्री करेंगे, दवा चलेंगे और उसमें आपका एक बाल लगा देंगे. ठीक, उसी से इलाज होगा.
मतलब बाल को कैसे, मतलब क्या?
आपने देखा नहीं मेरे वीडियोस को ठीक से?
ठीक से नहीं देखा.
ठीक है, आपकी पूरी अभी केस हिस्ट्री होगी. 1 घंटा हम सबके बहुत तक सब पूछेंगे आपका. उसके बाद आपके लिए दवा का चुनाव होगा. ये दवा का चुनाव किया जाएगा, उसको 2 तरीके से दिया जा सकता है. पहला, जैसे सारे डॉक्टर देते हैं मीठी गोलियों में खाने के लिए, जैसे आपने अभी तक ठूजा खाई है उसको अच्छे से, लेकिन उस तरीके के बजाय मैं अलग तरीके से इलाज करता हूँ. उसको कहते हैं बाल द्वारा होम्योपैथिक चिकित्सा पद्धति. इस चिकित्सा पद्धति में जैसे
You can click this picture of QR code and you can watch these cases and my website as well. You can take the screenshot.
कोई भी ना कुछ खाने का हाथ मिलेगा ना कुछ लगाने को मिलेगा. आप अपने घर जाएंगे, आप चाहे कोटा रहे चाहे दुनिया किसी को नहीं मिले, आप ठीक होते हैं.
This is a patient from Kota as well.
मतलब
And his friend was
बाल तो यहाँ रहेगा.
हाँ, यहाँ रहेगा.
astonishing how it is possible.
तरंगो द्वारा.
हाँ.
आप यहाँ है ना, लेकिन कोटा से कोई कॉल करेगा तो आप तक आ जाएगी ना.
I was trying to convince him.
आप तो नहीं लगाए, तब भी आ रही ना.
हाँ.
ऐसे ही.
Now on the 25th May this month, I have took his.
ऐसे हैं. सब क्लियर हो गया आपका वार्ड?
हाँ, हल्के हल्के निशान है, ये भी धीरे धीरे साफ हो रहे हैं सर.
His treatment is off now. Clinic from clinic.
इसमें एक्चुअली हमको क्लियर नहीं हो पा रहा है वीडियो में. तो
He got 100% cured for this.
सर मैं कल कर लूंगा फिर मॉर्निंग में 10 बजे के बाद.
हाँ.
अभी मेरे क्या है, यहाँ पे थोड़ा नेटवर्क का प्रॉब्लम है कंपनी में यहाँ पे.
लेकिन चेहरे से हमको सब अच्छा लग रहा है. बोल क्या है आज की फोटो की.
So this is another case of carcinosin from the Kushinagar. How you can see this part case got cured. So this was a short presentation about the different cases which I have shared with you. And now the question and answer session. I think I have completed my session within the time. 10 minutes was given for the question and answer session. Now, any person can ask the question and they can unmute yourself.
Thank
So
you, sir.
yeah.
Thank you, sir, for your most valuable time and the interesting session. It was very useful and it was very informative. And
Thank you.
doctor, now,
Yeah.
now if you are having anything to share, if you are having any doubts, you can unmute your mic and you can ask.
Anyone have any question, they can unmute yourself and ask your question. You see, in this conversation, in this presentation, there are many Hindi conversation because the language of my place is only Hindi. The patients are talking only Hindi. Only one or two cases I have seen in English, and that is obvious. But the results you can see with the video, with the photographs, are only with the evidence-based cases I tried to produce. There are many, many more cases which are also present at my website, raviclinic.com. You can go through raviclinic.com, and all the cases not possible to present all. I have tried to sum up all these cases that every case must be prescribed on the individual basis. Even I have mistake. Sometimes I do mistake that if I am seeing the similar case, I try to prescribe, but you will never get result. Homeopathy has no surrogate. Homeopathy is the art of individualization. Seemingly similar case will not respond to the same medicine.
Yes. Thank you, Dr. Ravi Singh Saab. It's really a very good session indeed, and you show the beauty of homeopathy and the relevance or importance of case taking, and that's the reason why you are able to cure such cases in a short time also. And what potency you used to give to patients?
You see, I'm always using the LM potency only. As advocated by the Hahnemann, I had a differentiation sometimes in the IFPS, I think, with the LM potency as well. LM potency was the potency which was advocated by the Hahnemann in the later years, and he said this is the most advanced potency I am advocating to you to use in all the cases. Although it is a much debatable topic that it was not Hahnemann. Sometimes they said that it was something they have modified the organon. But this was if you can see go through the history of the homeopathy, the different notes from the Rima Handley and all this history, you will find that this was the Hahnemann who was puzzled with the potencies and who was giving the potency in the higher dose that patient are not getting undue aggravation. In the lower dose, they are not getting the results. That's why he was in the lifetime he was a search to find his particular potency, and that was the LM potency. And in the transmission system, that medicine transmission to the hair, I always use LM potency only. And this was the most of the patient respond to the 0/1. Sometimes in the case, if the case is going right, sometimes we proceed with the second or third potency as well. 0/2, 0/3, or 0/4 as well. Most of the patient I got treated with the 0/1, and 0/1 is not at all, or 0/3 is not at all equal to the 30. 0/3 is very high potency. One must understand. Yeah. Tell me that.
It's just like atom bomb.
Yeah, it's exactly like atom bomb.
Yes. And
yeah, tell me.
what kind of do you advise any food management while treating homeopathy, or you just allow the patient to take that food?
I don't actually. This do's and don'ts has harmed homeopathy.
Exactly.
More than benefit. Sometimes the patients are coming to us, and when we say, why you have not opted homeopathy earlier, they said to us, because the homeopathic doctors are making so much excuses that you should not do this, do not take this food, that food before taking all this medicine. Ankit, इनको बताओ 6 तारीख को मैं बलरामपुर, इनको बताओ 6 तारीख को बलरामपुर आएंगे. Yes. So I never advise my patients to abstain anything like pan, gutka, bidi, cigarette, pan masala, anything with the smell. How a materialistic thing can antidote our dynamic medicine? The only thing was that in the diet and regimen chapter, if you'll read from the, I don't remember exactly that particular aphorism in which the Hanuman has said about the diet and regimen, why you should avoid all these things. Like you should not take anything. Suppose you are treating a patient with a gastric trouble. They obviously must not indulge with the too much spicy things, too much meat and all these things, because that will disturb their digestive system and you don't know whether your medicine is causing these things or the thing. So Hanuman has very rightly said, during a silent night, you can listen the voice of the flute like a melody, but the same flute, if played in the daytime, you will not listen like the melody. And likewise, during the treatment, the patient must be on the plain and bland diet and must avoid anything which has a medicinal property. So it was not saying that once you have taken 1 cup of the coffee, all medicine will be antidoted. Because in the Kerala, in the south, in the foreign, they are addicted of the coffee. Suppose you are drinking 1 or 2 or 3 cup of coffee, that is not going to antidote your medication. I have patients across the country. I have the patient from the abroad as well, from the Kerala, from the South India, the different part, and they are not avoiding coffee and they are getting the results. It's all about the right selection of the medicine. Even that particular myth that by touching the homeopathic globules, the medicine will be antidoted. Not at all. The Hanuman has said that by touching the homeopathic medicine, you can get the effect. He was educating that there are 3 medicines. The one is oral medicine, second was the olfaction, and third was the touch. He was educating the touch method. And homeopaths are telling, don't take that medicine directly through that particular hand. That will antidote your medicine. Your medicines are not so like. These are the energy medicine. Once it is getting touched with your body parts, it is bound to happen to act your body, depending your medicine selection is right.
Exactly. Yes, this is what we used to advise. But most of the doctors are stick up on the food and regimen, and they say that we need to control all these things, otherwise our medicine will not act. But frankly, if so, homeopathy will not work. But if you just allow the patient in that way, and we know that some of the lifestyle diseases, people used to take a lot of food, but we can ask them to take the food in correct timing. That is also.
Yes,
What's your
exactly.
opinion on that, sir?
Sometimes I advise my diet instruction to my diabetic patient, the hypertensive patient, to the patient with the gastric troubles. There are dietary regimen for the specific disease condition, not just
Exactly.
for the general condition of the homeopathy that they should not take this and they should not take.
Yes, Dr. Boblin want to say something. Yes, Dr. Bob.
I want to say something.
Yeah, tell me. Dr. Bob, please.
Okay. I would like to congratulate Dr. Ravi Singh today for his sharing of his experience in treating so many successful cases for the chronic cases of Warts. And it is good that you have documented it and you have approached it very well. And this has been a very informative webinar tonight. So congratulations and thank you. And I'm heard that you only use LM potency. Do you use something like 6 centimeter or 30 centimeter for treating Warts?
Actually, I was using that 6 and 30 centesimal potencies when I was prescribing oral medication. But when I have switched over this LM potency with this method of called as medicine transfer through here, in this method, what we do that we take that particular medicine in a glass vial like this, 2, 3, 9/10 of the water is filled over there, 1 or 2 drop of LM potency is putting here, and only one of the hair of the patient is getting inserted in this particular glass vial, and the patients are getting benefit at their place without eating this medicine. This method is called as medicine energy transmission, and this is a innovative method. The father of our Dr. M.K. Sani has discovered this particular method, and I am just a ardent follower of this method. I am only trying to cure all the cases which you have seen. Never received any oral medicine, neither any medicine to apply over the skin. All these cases got treated with this particular method, that is called as medicine energy transmission method only. So you can get more information from my two website, which I am typing, that is www.raviclinic.com, and another medicine is www.homeoenergy.com. These are the websites from where you can get more information about this particular method. Yeah, pick up hair from the root. Yes, hair must be pick up from the root. Either we can use cut hair as well. We can.
Oh, okay. Dr. Dr. M.K. Sharni has shared his method before, right? Okay. It's something very
yes,
awesome.
try it in your country and you will get the amazing result. At least in your family, you can try for this particular method.
Okay, I will just follow more and learn from you.
Yeah, I will be happy to.
This type of particular method.
Yeah.
Okay, thank you very much.
Welcome. Any more question? Only 1 minute is left now.
Yes, it is the time to say water thanks. Yes.
Dr. Smita.
So we like to invite Dr. Shruti Sarika to convey the vote of thanks.
She must unmute herself.
Oh, there is some technical. Anyway, congratulations, Dr. Ravi Singh, coming over here and delivering such a beautiful session for this evening. And we really enjoyed and very happy to share your thoughts with some friends also. Definitely, homeopathy, IFBH, international, as you all know, that the International Forum for Promoting Homeopathy comprises of homeopathy lovers as well as students and doctors. And definitely these videos will reach to the maximum people so that more and more people will know about what is happening with homeopathy in all these conditions. And we are really proud to say that Dr. Ravi Singh is going to become a big legend in the future, because that much of knowledge, that much of power in your presentation, we are praying for the same. And on behalf of International Forum for Promoting Homeopathy, as well as on behalf of myself, and thanking you once again. And those people, thanking you, the people who attended the session also. Thank you all.
Thank you.
And a big thanks to Dr. R. Sweda for excellent moderation in this evening.
Thank you.
What to Dr. Sweda?
Thank you.
Thank you all. Good night.